My voice is a little bit messed up because
It's
they
okay.
stretched my
Understand. No worry.
everything.
No worry. Just let it take easy.
When you're ready ครับ
Yeah. Good morning, Mr. Bobby. Can you tell us about yourself? What's your name? Where you come from, sir?
My name is Bobby, and I come from the United States, but we also have a home here in Surin.
I see. Wow, nice. And then,
And this video is being done at Bumrungrad International Hospital.
yeah. What is your condition before coming to the hospital?
Very bad. I had a near paralysis. My spinal cord, the C2, 3, 4, and 6, all had pinched really bad, and the C2, 3 were pinching the spinal cord 50%.
How was it affect your life?
Suicide. The pain was so bad I couldn't take it anymore. So my wife and sister-in-law insisted that I come to the hospital and get checked out and see what they could do, because I just thought it was just natural pain, nothing I could do about it. And I've always heard such good things about this hospital that I thought, well, can't get much better, might as well go see what they find out. So when I came in, they not only checked the neck issue that turned out to be very bad, they also checked my heart, bladder, kidneys. They checked everything. I mean, I had 7 doctors care while I was here.
And as you came to the hospital to see like so many doctors, right? And which doctor you like is the main of your doctor?
primary.
Vitamin.
ดรวิทวินเกษรศักดิ์
Yeah.
ค่ะ
He's the neurosurgeon,
Yeah.
but our primary is the female doctor.
เอาละ
Yeah, we can talk about Dr. Vitamin. It's okay.
Okay.
Because he like, yeah.
But how do you find it here? How do you find out about
My sister-in-law has been a patient or client of this hospital for 15 years. And we've come to see a couple other people that were inpatients here that came from other countries to get work done. So it was clear to us it was obviously quality. And you hear about it in the United States, you hear about this hospital.
how did you hear it? Like
Well, like I've told you, I've got a YouTube channel, so I've got friends that have been in and out of Thailand and have had to come to this hospital. One of our friends lives in New York. They had to spend a few nights here, I don't know, like 6-7 years ago. It was before COVID struck.
and you just all hear good words about it.
Yeah, I've never heard anything bad. You're not going to hear anything bad from me for sure. I'm so pleased with the work they did, and the pains I had before. I wouldn't be sitting here talking to you. The pain was just too bad. And I just got, I think 3 or 4 days ago, I had surgery, and I'm unable to sit here and talk with you guys. I've got to wear the collar because they cut all my muscles open in the back. And they were so thorough and checked everything so well that with their blood tests and everything, they determined that I'm a bleeder. I'm bleeding, and I'd never been before. Something new. And at a later point, I'm gonna come back here, and the hematologist is gonna figure out what's causing the bleeding. But anyhow, they thought in the beginning it was just my baby aspirin I take, which old people all have to take. So they stopped me for 5 days and rechecked again because the surgery was going to be the following day. And it was still way high. It was real bad. So they had to postpone the surgery and plan it again. It was supposed to be Wednesday a week ago, and they canceled that and moved it to Saturday.
Okay. How is your surgery? It went well. Everything is okay. You happy with this?
Absolutely. I mean, you couldn't ask for a better team. I mean, Dr. Wittewin travels and teaches, and he was so confident when he talked to me. There was absolutely no question in his mind, even though he and Dr. Paween said that the surgery they're doing on me is very rare and it's very high. They rarely ever have to deal with the C2 spine, and it was a critical position that they wouldn't let me even leave the hospital. They said all I had to do is trip and fall down. It could break my neck, be the end of me walking ever again.
So after surgery, how long you can recovery? I mean, right now you feeling better, right?
I'm
take
already
time.
feeling so much better. Even the doctors are very surprised how quickly I'm recovering from this, because I'm just a few months from being 70 years old.
Wow.
So recovery at my age, I figured, it's going to be a long, hard road, but I can see now it's not going to be. I'm going to bounce back. I've got to be very careful, but because of the bleeding, they couldn't fuse my spine like they originally planned to do. They were going to go through the front and do all of the problem areas, but I was bleeding so bad they knew I would be, so they went in through the back and only did the 2-3, C2 and C3 spine. But that was the most critical ones. The other ones, it said, may not be an issue and could be years if they are.
Okay.
Tell us about when your surgery on Saturday and how long?
He told me somewhere between 2 and 3 hours, and I think it was about 2.5 hours. So when I woke up, I was in the recovery room, and I didn't feel anything. I asked for somebody, how much longer are we going to be before we get started? And they said, oh no, you're in recovery now. You're finished. Everything went well. Your wife's been notified, so she's not worried about you. And you still, because your platelets are low, you're bleeding still. You've got bleeding issues, and they put a tube in me. And I had been draining for 4 days. And they just took the tube out yesterday. That they kept adding bags of platelet to get my blood to start clotting and seal the wounds. So they're incredible. I mean, every one of the doctors came to the room and visited me every day, and they didn't just come in like, how you feeling? Okay, good, see ya. They literally sat here or stood there and had concern as they were talking with me, and that was extremely high in my mind.
Yeah. You want to say something to the doctor?
I told them when they came to the room that you guys are outstanding. I would tell the world about you guys. Awesome surgeons, awesome care in the hospital. Everybody that's come in here to deal with us has been so friendly and kind, and I think it's the Asian personality to start with. I mean, I'm married to one, so yeah, I'd recommend for sure. And the surgeons, all the doctors I dealt with were really good.
Okay. And would you like to, do you have any feedback to our hospital? Especially our Dr. Wittewin or other facility? You want to
There's
give a
nothing
feedback?
you could tell that guy. He's so confident and so good at what he does that, I mean, that's strong. when you can be a surgeon and you've got a patient that's scared, I mean, there's no question. I was scared. I was on the edge of being paralyzed. And I knew it didn't take me much of a movement to become paralyzed. And he came in here just as calm as could be. He says, I'm so positive there's going to be no problem. I'm not concerned at all. Don't worry about this. You're in very good hands. He said, I've got a very good team, and he obviously does.
First day you came to hospital, met Dr. Litwin. He right away to tell you you had spinal cord
Yeah,
compression.
just with his testing of
Just quickly.
mobility, things that I had wrong. I mean, he's so knowledgeable about it. He knows the signs relate to a specific problem, and
He told you right away.
he told me exactly what was going on. And then when they did the MRIs and X-rays and stuff, it was exactly what he said. Yes, that's good. I mean, they're all very confident. They're sure of what they're doing, and they've done hundreds of these surgeries, hundreds.
Okay.
My wife's a retired RN, and she Googled the doctors to see things about them.
Just to be sure.
Yeah,
And we're so happy because Dr. Litwin, he was intern in Surin Hospital.
Yes.
Yeah. yeah.
And I
Jai,
met him too.
Jai retired from the Surin Hospital and then moved to the United States. Had to get her NCLEX and all the
see.
other things to be able to nurse in the U.S. So she went there and nursed for 13 years.
So you're going to be in good hand after
Sure.
Yeah.
this.
And that's everybody that came in here. I made sure everybody knew she was a nurse, and everybody then started comfortably not just talking to me, but talking to her too, and make sure that I understand everything and the severity of it. And I couldn't lie to her because, I mean, she knows better. But it's a great hospital. The whole first day when we came in, like I said, we had 7 doctors. We were set up for multiple appointments. And as we were going, you can't get this in the U.S. I guarantee you can't. You will go back multiple times, multiple days to see all this many doctors. But they all kept shuffling their schedules around to fit us through, to get us in while we're here. And our return visit, they're all working it around to where next Monday they'll all be able to see me. So, I mean, how much better can that be? To be able to walk into a hospital and get MRI 2 days later,
One day, only one day.
1 day later, to get an
Yes.
MRI 1 day after you're into the hospital just for a checkup, you can't get that in the U.S. either. Not unless you go in the ambulance and you're dying. So all my care will come here now. Will come here.
Perfect.
That it?
Yes.
Okay, I thank you guys very much for coming and let me
Yeah.
share this.
We should say thank you to you too. Thank you very much to sharing very nice experience to us. Yeah. Thank you. To
Okay.
trust in our hospital and our doctor too.
Okay, thank you very much.
Thank you ค่ะ
Welcome up.
We're glad you had a
อืม
good experience.
Yeah, and good results.
yes
Good results.
โอเคค่ะ